You stand up, and for 2 seconds, the world flickers.
Most people call it nothing, but it isn't nothing.
After 60, this small moment shows up more often. A flicker of unsteadiness when getting out of bed. Familiar enough to ignore, but specific enough to mean something. It isn't simply rushing the movement. It's a signal. Something in the system that quietly manages your blood pressure has shifted, and it's beginning to show. Every time you stand, gravity pulls roughly 500 to 700 milliliters of blood downward into the legs and the abdomen. That's nearly a pint falling out of circulation in seconds.
In a younger body, the system corrects that instantly. After 60, the correction is slower, and that delay is exactly where the symptom lives.
Tucked inside the walls of the carotid arteries are tiny sensors called baroreceptors. They feel the pressure of every heartbeat, and they react the moment it changes. When pressure drops on standing, those sensors fire. They send an urgent signal up to the brainstem. And the baroreflex, the body's invisible rescue, begins. The heart receives the order first. Speed up, pump harder, push more blood toward the brain, before the brain notices anything is missing. At the same time, the leg muscles squeeze the veins. They act like a second heart, pumping pooled blood back upward against gravity. When that response is even a second too slow, blood doesn't reach the brain fast enough. And the brain, sensitive as it is, sends a warning of its own. That warning is the dizziness, the lightheadedness, the brief sense of not quite trusting your own legs. A private moment most people never describe out loud. Some people see the room dim, as if a dimmer switch were turned down. Others feel a wave of warmth or a strange sense of floating, for 2, maybe 3 seconds at most. A rushing sound in the ears, pressure behind the eyes, different signals, but the same root cause, a brain briefly running on less. It passes quickly, but brief doesn't mean meaningless, because behind those few seconds is a system telling you something specific about how your body is changing. It rarely depends on a single cause. Dizziness on standing is almost always a meeting point, several small factors arriving at the same time. Dehydration leads the list. After 60, the sensation of thirst itself becomes blunted. You can lose enough fluid to affect blood pressure without ever feeling thirsty. Meals matter too. A heavy lunch shifts a large share of blood into the digestive tract. In a younger body, the rest of circulation adapts effortlessly. In an older one, the margin gets thinner. This is called postprandial blood redistribution, and it's why standing up shortly after eating can feel different than standing up at any other time of day. Heat does something similar. Warm rooms, hot showers, summer afternoons, they all widen the blood vessels near the skin. Less blood stays where it's needed most. And mornings are the most demanding moment of all. Blood pressure is at its lowest. The body has been horizontal for hours. Standing up is physiologically the hardest thing you'll do all day. Then there's the medicine cabinet. Some of the most important contributors to this symptom sit on a shelf people open every single day. Diuretics lower fluid volume. Beta blockers cap how fast the heart can react. Alpha blockers relax the vessels. Each of these drugs does its job, but each one also narrows the margin between standing safely and standing with symptoms. The challenge is that older adults often take several medications at once. Polypharmacy. 4 pills. 4 separate reasons the body finds it harder to keep pressure steady when you stand. Some weeks, the symptom seems to disappear entirely. Then it returns, sometimes more intensely. That variability isn't random. It reflects how all of these factors shift together day by day. What does change steadily is the body itself. The pressure sensors stiffen with age. They still work, but they respond a fraction of a second slower than they once did. Over time, that small slowdown teaches the body something else. How to brace before standing. How to grip the armrest, just in case. These habits aren't conscious decisions. They're learned, built from years of small moments, repeated until the body knew them better than the mind did. And gradually, the world becomes a little smaller. Fewer outings, less movement, a reluctance to stand quickly, in case standing quickly is what triggers it. The most serious consequence is the one no one wants to think about: falling. A single fall in someone over 65 can change everything that follows, which is why these few seconds of dizziness deserve far more attention than they usually receive. There's a system in the body that runs all of this without asking permission. The autonomic nervous system, working underneath every breath, every heartbeat, every shift of posture. It has two opposing branches. One speeds the body up, the other slows it down. Standing requires them to switch roles in less than a single heartbeat. After 60, that switch becomes less precise. The brake releases slightly late. The accelerator engages with a little less force. The timing slips. At the microscopic level, some of the small nerve fibers that tell blood vessels to tighten begin to thin out. Some still glow brightly. Others fade quietly. Long-standing diabetes. This damage advances silently. Years of elevated blood glucose injure the small fibers that control vascular tone. By the time the symptoms surface, 15 years of change may already be behind them. In Parkinson's disease, the same process that affects movement also affects these autonomic centers. Sometimes dizziness on standing arrives years before any other sign, a quiet, early hint. And then there's the blood itself. Anemia, fewer red cells, less oxygen carried, means every small drop in pressure costs the brain more than it should. Heart rhythm matters as well. Atrial fibrillation, the most common arrhythmia after 65, makes each beat less predictable. Stand up during an irregular run, and the timing of recovery shifts. Even structural changes inside the heart, a narrowed valve, a weaker chamber, can limit how quickly the body answers gravity's challenge. Diagnosing this seems almost too simple. Lie down, stand up, measure the blood pressure, watch what happens in the first 3 minutes. A drop of 20 points on the upper number, or 10 on the lower, within 3 minutes of standing meets the formal threshold. But the clinic doesn't always reproduce the moment that matters. That's where the tilt table comes in. A patient is gradually rotated toward vertical while every heartbeat is monitored, capturing the response in real time. Finger cuff monitors catch what standard tests can't. The rapid drop that happens in the first 15 seconds then disappears. A brief signal, but a real one. Blood work fills in the rest. Anemia, kidney function, glucose, thyroid. Each test maps a different layer of the same picture. None of these tests by itself tells the whole story. Together, they map the landscape, and that landscape is where the real answer usually lives. The most effective change is often the least medical. Rising in stages, sitting at the edge of the bed for half a minute before placing feet on the floor. Hydration is the next layer. A generous glass of water before getting out of bed expands blood volume and can raise standing pressure by a meaningful amount. For some, not all, a small increase in dietary salt may help. by holding more fluid in the system. This is a conversation between a patient and their doctor, never a blanket recommendation. Compression garments hold blood where it would otherwise pool. Waist-high and abdominal compression actually work better than knee-high stockings because the abdomen holds far more blood than the legs. Simple physical countermeasures help too. Tensing the leg muscles, crossing the legs before standing, manually pumping blood back upward in the seconds before gravity pulls it down. For many people, the most impactful step happens in the doctor's office. Not stopping the medication, but reviewing whether the current regimen still fits the body taking it. Sometimes the answer is as small as shifting a dose from morning to evening, a change that costs nothing and can change everything.
Sometimes a drug is substituted. Sometimes one started years ago for a problem that has since resolved can be safely discontinued. The goal isn't less treatment. The goal is the right treatment.
And when behavioral and medication changes aren't enough, there are specific medications designed to raise standing blood pressure, used carefully when other options have been tried first. What makes this condition matter is its reach. It touches the heart, the vessels, the nervous system, the blood, the brain. It connects nearly every system that changes with age. And when it's understood and managed well, the difference is real. Walking outdoors with steadier confidence, standing without bracing, moving through the day without that quiet edge of caution. Large studies tracking older adults over many years have shown that confirmed orthostatic hypotension predicts more than discomfort. It carries meaningful prognostic weight. It's worth taking seriously. And yet, most people who experience it never mention it. They assume it's just getting older. They assume nothing can be done. Both assumptions are usually wrong. It can be evaluated. It can often be improved, sometimes dramatically, with changes that cost nothing and require no prescription. But it begins with noticing, with paying attention. Those few seconds of unsteadiness aren't trivial. They're a signal worth listening to. If you have symptoms that concern you, or if there's another body signal, age-related change, or medical topic you'd like us to explore in a future episode, share it in the comments below. If this video was helpful, give it a like and consider subscribing for more videos like this one. Thank you for watching.